It's been 2 months since a controversial methadone clinic opened in the Tri-Cities, but many are still wondering what happens behind the doors and how does the treatment work? How is the methadone dispensed?
Yeah, and what safety measures are in place to protect you? You ask and we're answering. Sydney Cameron takes us inside Overmountain Recovery.
As Margie Hale looks out her front porch, she still isn't sure what viewpoint to take on her new neighbor, Overmountain Recovery.
I feel like we won't see the effects of it for a while.
Like many people in Gray, Hale didn't want to see this methadone clinic open in her tiny community. But it did, and now many are curious about the new neighbor and what happens behind their doors. We went inside the medication-assisted treatment center owned by ETSU and Mountain States Health Alliance to get a first-hand look at the opioid addiction treatment process. When does methadone become a viable option for treatment?
So a lot of our patients have tried other treatments and maybe those have failed for them.
Clinic program director Lori Street says most of the 70 patients here abused heroin. When they first come in for treatment, they go through an hours-long assessment to see if methadone is right for them, talking to counselors and doctors and having labs drawn. The next day is orientation, where each patient gets their own treatment plan.
Okay. So this is our dosing hallway.
7 days a week, a patient will come here to take liquid methadone. Street says nurses monitor patients for about 20 minutes for their first visit and just a few minutes each visit after that. The methadone is stored in a safe behind several locked doors.
Lots of counts. We always have to have two nurses that do the counts at the end, and you can see all the notebooks over there of the different reports we have to keep to make sure everything's correct.
But Street says the methadone is only a small part of what they do at Overmountain Recovery.
So how many therapy rooms are here?
We have 9 therapy rooms.
Therapy is a big focus. For the first 4 months of treatment, patients are required to attend at least 2 counseling sessions per week, individual and group sessions focused on topics like anxiety and coping skills. After that, the requirements drop slightly, but patients will always go to therapy at least once a month.
Medication alone without talking about your life is just not as effective.
Dr. Randy Jesse specializes in substance abuse and is a consultant with the clinic. He says helping patients understand their disease and triggers is just as important for recovery.
I really do engage in recovery. You need to talk about who you are and where you've been and where you want to go.
After 3 months in the program, patients are eligible for 1 take-home dose of methadone a week. Take-home doses increase the longer a person is in the program.
The medication will be prepared and sealed and in a lockbox. They also have to return the bottle to us so we can be the ones to destroy the bottle.
Street says patients have to meet several requirements to get a home dose, including passing all scheduled and random drug tests and attending diversion control meetings. At any time, the clinic can require them to come in for random lockbox checks. If they break a rule, they lose the privilege.
Yeah, they're not getting high from it.
We reached out to Dr. David Kershke with the Tennessee Health Department to find out what effect methadone has on the body. He says it does not impact a person's ability to perform everyday activities. It prevents cravings and withdrawal symptoms, but there is a reason it's dispensed in a controlled environment.
If a patient took too much methadone, there'd be a higher risk for overdose.
Overmountain has retained 95% of its patients since opening 2 months ago. Street thinks that's proof the treatment works.
We're starting to see these people who have been with us for a while really take an interest in their appearance.
While some patients hope to one day no longer need methadone and the clinic constantly evaluates treatment plans for that goal, Street realizes that may not be realistic for everyone.
We're just trying to do something for this opioid crisis, which is huge.
I know they need it, but I just wish they'd put it somewhere else.
Meanwhile, Margie Hale tries to take comfort in the extra police patrols around the neighborhood and security guards at the clinic to keep her safe. Police say there have not been any issues at the clinic since it opened. Sydney Cameron, News Channel 11 in your corner.
Overmountain Recovery says it follows state guidelines and patients can be discharged from the program if they continue to use opioids over a period of time.